Start recording it. Um, it's okay. Okay, so can you just tell me your name, what you do, and your age?
I am Allie Hubert. I am an EMT and I am 21 years old.
And where do you EMT?
I work at Tri-Community Ambulance in Wheatfield, New York.
Okay, cool. So what do you do as an EMT?
So generally what we do is we respond to 911 calls of any type for any sort of medical emergency. So yeah, pretty much anything from I fell down and I pushed my life alert button to somebody in cardiac arrest who we need to do CPR for and intubate.
Right, and it's gonna be like more than just you, like you'll have like a crew on with you?
Yeah, yes. So most of our ambulances run with 2 people on them, and then we have an ALS fly car, so that's an additional person. And then the fire department also responds with us, so we have more hands. Okay. What made you want to become an EMT? So my parents met working on an ambulance. My dad was a paramedic. He actually still is a paramedic, and my mom was an EMT. And then when I turned 16, I wanted to be a firefighter. That's the age that you can be to get all of your certifications to be a firefighter. And they would not let me be a firefighter. So then when I turned 18, they let me take the EMT class. But mainly it's because of my parents and kind of just following in their footsteps.
Right. So can you just do like, I know you kind of just talked about it, but like a little like journey to now, like maybe like, so like are you in school to like continue medical research and stuff?
Yeah, I am currently a senior at UB for biomedical science. I've been doing research for about a year now. Yeah, about a year now. And been doing cardiovascular research and focusing a little bit more in emergency medicine. But I've also taken my MCATs and I'm working through UB's pre-health committee and will hopefully make it into med school someday once Corona's over.
Right. So with the whole Corona thing, can you just like talk about like from the beginning of like the year to like now, and like if you've had like an influx of patients with that, or if you had to take like specific new precautions now?
Yeah. So at the beginning of the year, we weren't really worried about it. Even a month and a half ago, we were kind of like, is it going to be a big deal? Is it not going to be a big deal? Right now, my town is the second highest, has the second highest number of confirmed COVID cases in my county. So we definitely saw that increase over the last month. And we basically scrambled to get as much equipment as we possibly could, as much personal protective equipment, things like that. And we're finding that we got all that we could and we didn't get enough. And then we've seen the influx in patients, and the patients they're sick. I mean, we're doing all that we can for them, but it's really, we're just doing not enough, but it's all we can do.
Right.
So it kind of sucks.
So do you have like a specific protocol that you have to follow, like when you know you have a COVID positive patient?
Yeah, so our dispatchers ask a series of questions when somebody calls 911, and then that information gets relayed to us, and they'll say, we asked these questions, and then they'll say either they said yes to them or they said no to them. And then we know many of the places where there are positive COVID patients. So we are wearing surgical masks. So our protocol is very, very extensive and it changes every couple days. But if you go into a patient's house where it's suspected or confirmed COVID, or they're displaying COVID symptoms, even if they're not suspected, you wear a surgical mask and they get a surgical mask. So that's your normal. Actually, I have some. So that's one of that's like one of these masks, and then I don't have any N95s in here, but if we're doing, because we are so low on supplies, if we're doing certain procedures, so if we are giving an albuterol treatment or a nebulizer treatment, intubating, suctioning, doing CPR, ventilating, there's a couple other things. We have to wear complete gown, N95, eye protection. If we have hair, if we've got little bouffant caps, we put those on. And that's really just to limit the amount of PPE that we go through. So we're trying to keep that number to a minimum, and then that's just for what we use and what equipment we use, and then there's different protocols for how we treat them, because certain patients are indicated for certain treatments and not. But then they can pretty much go to any hospital. We just have to alert the hospital and tell them that we are bringing in a patient with COVID symptoms.
Okay, cool. It's a lot.
It's a lot. It's a lot to take in and a lot to remember, and our crews are struggling to do it.
I'm sure. So I guess a lot of the questions. So one is just like, what does like, can you just like articulate like why like EMTs are important, and like why like especially right now with the coronavirus, like why you guys are so essential?
Oh yeah. So EMS in general, EMTs and paramedics are truly essential, because when you call 911, you need somebody there right away. You need somebody who can treat you, fix you, and then get you to the hospital. There's a huge misconception that EMS is all we are ambulance drivers. All we do is we drive you to the hospital like we're a taxi. That is not even close to true. We can do anything from lift you from the ground to put a tube down your throat and breathe for you. I mean, we do most of the same invasive procedures that they'll do in a hospital, in the emergency room, and we do it in a fraction of the space. So we get that essential care to somebody much quicker than they would get if they had to drive themselves to the hospital. And then during the COVID pandemic, we're still providing that same service, but a lot of COVID patients right now, we are doing we have a treat and release policy. So if they aren't critical and they don't need to go to the hospital right away, we will treat them at home, and then they will stay at home, so that we limit the number of people at the hospital who might potentially be exposed. So right. we're still treating patients, and then we're keeping them healthy enough to stay at home.